To the coronavirus this morning. Right now, Indiana is seeing a record number of Hoosiers hospitalized with COVID. This is the first time the numbers have climbed above 3,500, and it beats Thursday's record-breaking day by about 60 patients. The state is also reporting nearly 16,000 new cases of COVID-19 as this surge continues.
And with this increasing number of cases comes the increasing need for COVID tests. But if you've looked for them, you know those at-home tests are pretty much impossible to find right now.
Right, and now there are a lot of changes coming to how you get one and who pays for it. Starting today, you can get reimbursed for those at-home rapid tests. And next week, you can request free tests from the federal government. They're going to offer up to 1 billion tests to Americans.
You can start ordering them next Wednesday through the hotline or at the website covidtests.gov, but that site is not up just yet. Once it is online, you can order up to 4 tests and have it sent straight to your home.
There's a new push to change those at-home test kits to better detect the Omicron variant. Our Emily Longnecker has the story.
With the Omicron variant causing a rise in COVID cases across the country, the Food and Drug Administration is being urged to figure out how well those rapid at-home tests detect the variant.
If you can find one of those rapid tests these days, you're lucky, both in stores and at testing sites.
All tests are hard to come by. That's why I would say be careful about being too picky, right? I mean, if you can get your hands on a test, I think you should just do it if you need it.
That's where Dr. Amy Beth Kressel stands, even after seeing news of recent studies with some evidence that the Omicron variant shows up in the throat first and not the nose. That's reportedly led to pressure on the FDA to recommend people swab their throats instead of their noses. Right now, though, the at-home rapid tests contain nose swabs, and that's just how Dr. Kressel says they should be used.
It was designed for the nose, and if you tried to take a throat specimen, there might be things there that would cause the test not to be valid.
That's why Dr. Kressel thinks if throat swabs are the way to go to detect Omicron, it'll take time to get the test right.
I think before manufacturers are going to be able to recommend doing throat swabs, they're going to have to prove the throat swabs work. And that will probably take time, and I don't think people should be waiting for that.
Instead, Dr. Kressel advises to take whatever test will give you the quickest results. If it reads negative but you still feel sick, she says go get a PCR test or wait a few days before trying a rapid test again.
If you need a test now, get the test that you can get, right? I don't think people should be shopping around trying to get a saliva test. I think that they should get whatever they can get their hands on.
And good luck finding one. If you're lucky enough to get one of those at-home tests or an appointment, you want to make sure you're not wasting it, right? So when is the best time to take that test? This morning, our Verify team found the answer.
Is it true the optimal time to test for Omicron is 5 days after exposure for most accurate results? Well, our sources are the CDC, an MIT study published in the Annals of Internal Medicine, and Dr. Chris Uhl, infectious diseases physician for Atrium Health, Wake Forest Baptist.
The time to test following an exposure to COVID is roughly 3 to 5 days. For both Delta and Omicron, probably closer to 3 days makes more sense because the virus is more transmissible and it tends to cause infection faster.
So yes, testing 3 to 5 days after exposure is best, and that's a slight difference from the 5 to 7 days health experts recommended in 2020 and early 2021 before Delta and Omicron entered the picture. And timing is key. A 2020 MIT study looked into the probability of a false negative on a COVID test. On the first day after a probable exposure, the likelihood of a false negative was 100%. That percent decreased with each passing day. And the CDC has updated its isolation and quarantine guidelines for Omicron, saying the science shows transmission occurs 1 to 2 days prior to symptom onset and in the 2 to 3 days after. So in all exposure scenarios, whether you're vaccinated or not, the CDC suggests you test on day 5 after coming in contact with someone with COVID. And with this variant, any type of test that is FDA approved can give accurate results.
Either a PCR test or a rapid antigen test is fine, and the home tests are fine for doing it as well.
In conclusion, we verified, yes, it's true. The optimal test time for Omicron is still 5 days after exposure. But given how fast Omicron spreads, you can test as early as 3 days and likely have accurate results.
Hey, let us know if you've got something you'd like us to verify. Email verify@WTHR.com. You can also reach out anytime on Facebook and Twitter.